Whilst mainly a technical role, I've got a lot of experience in product marketing, brand management and PR, so it's that hat that I'm wearing today when I'm talking to you on this. It may sound weird, but this is almost a sales pitch from the NHS. Bear with me and all will become clear. I'll also explain some of the benefits and learning that we found along the way, in keeping with the theme of today's talk, so I'm not going too far off piste. The NHS.UK, it works pretty well, constantly being refined through lots of user testing. We're gradually improving the user friendliness. We're still working on it. As you can see there, it's pretty popular. 583 million visits. Now it's bouncing around about the 2 million visits per day. We're averaging around about 12 million a week. And the key figure there is 68% mobile usage. That's been ramping up obviously over the last couple of years. I think only about 2 years ago it was about 50-50. So it's bouncing up more and more on the mobile side. And that's a chicken and egg thing. The more we've actually targeted the site to work on mobile, then more people have adapted it on that side of things. This actually shows the breakdown of visits by section. So treatments and conditions is by far the most popular sector, or sector, if you're from America. Service directories gives information about GPs, A&E, dental, health services, etc., etc. If you want more info on our website usage, then Google NHS Choices blog. You'll find a whole bunch of weekly updates there, and these often include massive blips in page views due to, say, an EastEnders episode with an illness or a celebrity with an illness, for example. Digital tools, this is what I'm responsible for. As you may know, we develop both web-based tool and mobile apps. It's horses for courses. Mobile apps are great for long-term tools where they're used multiple times and need a history kept for, say, smoking cessation or couch to 5K or smart sugar, for example. Whereas web tools can be more easily syndicated outside of non-health webs or into non-health websites. Therefore, you can spread the health word more easily, shall we say. These are some of the examples of the web-based tools that we currently have on the site. And before I get on to how all this can benefit you, let me tease you further with a few more interesting stats. In the last year, we had 1.6 million uses of the depression and anxiety self-assessment tool, 1.9 million completed uses of the weight loss guide, which is actually a set of PDF printouts, which is quite interesting as well in terms of non-digital use there. 850,000 have found out their heart age using the heart age tool, and there have been 2.2 million uses of various visual guides, skin problems, moles, baby rashes, sexual health, for example. Not surprisingly, the BMI calculator is our most popular tool, with 3.5 million completed uses in the last year. However, more than just collecting top-line numbers, we collect data, anonymous of course, to help improve the tools as well as to spot trends. As you can see here, for the last 30 days alone, there were 498,000 completed user journeys of the BMI calculator. And the stats are showing 53.5% of that 500,000 being either overweight or obese. That then breaks down further, and as you can see here, 120,000+ using it in the 21 to 30 age group, but we've got significant usage in the sort of the 40 to 50 to even the 60 up to 70 usage, 70 age group there with nearly 40,000. This then breaks down into the weight category percentage per age group. So for here, for example, you can see the highest proportion of underweight users in the blue are in the 18 to 20 age group, and that's around 8,500 teenagers. This is just to get you thinking about big data, or at least bigger data, and useful numbers, useful to you possibly in more ways than one. The data we get from any tool can help us build a picture of user health, a very rough state of the nation marker, if you like. It's effectively crowdsourced health research. Create the right tool, give the user a decent quid pro quo, so it's not just a big brother data gathering exercise. Gather that data, and this can be used for the common good as well as for commercial benefit. And then refine the picture further. Imagine the data analysis potential with a couple of million uses of your own tool. For example, the gender and platform data here alone begs quite a few questions. Why the discrepancy between female mobile users of the BMI calculator and the desktop users? we've got an 8% swing in the number of overweight and obese people, female users on mobile to desktop. Don't ask me why, it just popped up in my analysis. And these are not small numbers either. We're talking roughly 50,000 female mobile users here in a month. So, how's all this relevant? Well, the Health Apps Library, as was created to provide a safe and trusted resource for patients, which had gone through an assurance process rather than just bringing in commercial apps to the NHS. It had its good points and not so good points, and as some of you will remember from news headlines towards the end of last year. It was actually decommissioned in October. The main thing we learnt, though, is that just putting apps onto a separate website and expecting people to go there and use them isn't the best way of driving uptake. Promoting them in context to people in relevant places is much more effective. This is the key part here, the National Information Board. Don't know how many of you have heard of it. Any hands up if anyone's heard of? No, okay, well, if you're getting into apps and that side of things, just Google National Information Board. Basically, they are designing the processes going forwards for personal healthcare. And the 1.2 work stream is all about the digital roadmap for apps, health apps and social care apps. And then the 1.2 team is pulling together knowledge and processes that will enable health and social care apps to be assessed and approved or endorsed for use within the NHS. It's more than just the approval for use on NHS websites. We're also exploring different ways to increase adoption of digital products, for example, the links to commissioning, recommendation from healthcare professionals, and recommendations out to healthcare professionals, working with app stores, and obviously data governance. If you want to know more about this, as I say, Google NIB 1.2. You'll find all you need there. It's work in progress, but the progress is being made, and it's going fast. The objectives, I'll quote directly this is just the one boring part, but it is quite key. The premises of this work stream, which will need to be tested as part of their work, are that endorsement can encourage health and care professionals to recommend the use of safe and effective digital applications and give greater confidence to patients and citizens to select and use them. There is also a premise that endorsement, considered as part of a broader adoption model for digital, can contribute to the development of a dynamic and sustainable app market in the UK. So this is, for example, relevant to the first speaker this afternoon. Okay, so how is this particularly relevant to you? Well, just think if you developed a health app or web tool that was approved for use on our site and elsewhere within the NHS. There were 56 million page views of the pregnancy and baby section of the site last year. 2.5 million people used the baby due date calculator. 1.9 million read the foods to avoid in pregnancy page. And on the right-hand side, 7.6 million page views within the lose weight area. Now, apps will be placed where relevant to the user. So if you develop a pregnancy monitoring app, for example, it'll be placed over in the section over there. Okay, initially this looks great for us because obviously on the NHS we get more apps that help the general population. So what's in it for you? Well, before you switch off thinking it's another sales pitch, and let me put on my marketing hat again. I'm not so naive as to think you don't want your pound of flesh. Obviously, you need to make a profit. I get it. I was in the private sector for 25 years before switching to the NHS, and I'm still fighting that public sector assimilation process. I'm a commercial guy wearing an NHS badge, basically. So there's nothing to stop you creating a massively garish neon sign kind of app that is overtly commercial. For obvious reasons, if, say, Strava was to submit itself as an exercise app, we'd be foolish to turn it away before evaluating it. One of the opportunities for pharma in digital is to do with the pill plus X. As medication gets cheaper and prescribers go for the cheaper, less bespoke options, we know a lot of companies are considering apps to go along with medication. You could do something for medication adherence, for example, or self-management of a condition like COPD or diabetes to work in conjunction with the drugs you produce. However, and just bear with me on this, Look into my eyes, not around the eyes. Look directly into the eyes, not around, just into my eyes. 1, 2, 3, you're under. Okay, just ponder on this. A lot of companies spend a small fortune on brand promotion. Take a proportion of that money and do something altruistic. Build an app, not a commercial app, but a non-commercial, something that could be construed as a not-for-profit. That benefits the user's health and is not a buy brand X kind of hard sell. Keep branding to a minimum, keep it subtle. The English don't like a hard sell and they don't like propaganda. Submit it and get it approved for our site. If it's good, watch potentially millions of people use it day in and day out. And that's a weekly visits to the site chart there. Get stories in the national press about how you're helping the nation's health. Everyone knows it's still a commercial product, but your visible primary benefit is to the end user. They benefit from having a diabetes monitoring app or a better way of coping with COPD, for example. The NHS obviously benefits because potentially your app might help reduce the burden on primary care. You benefit because of all that good publicity means that you get that constant drip, drip, drip of your minimalist branding to potentially millions of users. And this tool, we actually worked with British Heart Foundation to create this tool. You also get massively crowdsourced clinical data from the high numbers of users you'll get by being endorsed and visible on our site. Our heart age tool, for example, gives us height, weight, gender, ethnicity, age, whether they smoke, are diabetic, have atrial fibrillation, whether there's a history of CVD in the family, and of course their heart age. Anyway, I'm sure actually if you gave Jimmy Carr's accountant a call, he'd probably figure out a way of working with a health charity to get it all written off against tax, but I'm not going to go there. If you are a charity, why not pester companies to work with you on this? Then, after 6 months, calculate return on investment, press coverage, number of users, data outputs for clinical research, etc., and brand recognition versus cost. 3, 2, 1, you're back in the room. Okay. Corny, I know. Either way, it's just to try and get you thinking outside the box. Think about the opportunities coming up and how you can use this to your advantage. What I'm trying to say is don't automatically go down the safe and traditional route. Try something a bit off the wall. It may pay dividends. If you are interested in developing apps or tools that can be approved for use within the NHS, then get in touch. Got plenty of experience in health tools as well as computer games, as you say. Quite good at connecting people. There's a lot of silos within NHS England, Public Health England, NHS Choices, GDS, etc. Can help there. A lot of experience in agile development and user-centered design, as well as the data gathering and analytics, i.e. structuring how best we can gather the data without it coming across like Big Brother, demanding answers. So even if it's just some advice on how you could start the process or where to look, then get in touch. And I'm here to help, and although that's my altruistic nature coming out, I always temper that with the realities of the marketplace and product development. You always need a solid product at the end of the day. Thanks so much.
I've got a couple of questions, but I'm sure there probably are some in the room that don't need me to start things off. No, there aren't. Okay, I'll ask you one. And don't have to answer this, but the decommissioning of the NHS health apps was because you thought it wasn't the best thing to... Was that genuinely we thought it wasn't the best thing to do to put it on a website? And
there were a bunch of reasons. I mean, a couple obviously was the fact that I think it was created and then just left to its own devices and it sort of started to fester. And there needs to be processes and people in place to constantly check those apps that were on there, which patently failed, and therefore we got the news stories about apps that weren't safe, etc., etc. And that's where the NIB 1.2 are working at the moment in terms of all those processes and peer review, etc., etc. And there needs to be all that behind there so that the tools can be and apps can be sort of approved and maintained at that level of approval and clinical governance, etc., etc.
And can that happen now? Because there are businesses here probably thinking, actually, we're doing something quite cool. We'd love the NHS to endorse it. Are there processes now to... Because you're proactively saying, contact me. I imagine there's people in the room already going, right, I'm emailing him tonight. So are you actively saying, come and talk to me?
The processes are not completely defined, but that's not to say that we're not taking stuff now. So we've got to kick off the process somewhere, and we're already looking at a couple of apps in terms of, okay, does it meet certain criteria? Can we then get it on the site and then start getting some feedback, etc.?
Hi, it's Julie from Raremark. We're developing apps in rare disease, which is huge unmet need.
Yeah.
When will the 1.2 roadmap be ready? Broadly, month, quarter, year, anything?
I think it's meant to be the end of this year. They are certainly working pretty quickly on that. Again, it's a big box of worms that they're trying to sort of, you open one part and you find another part, and then there's an awful lot of stuff, as I say, clinical governance, all sorts of various areas in terms of that. But I think certainly the processes will be defined sort of towards the end of this year, but that's not to say that we can't get stuff going beforehand. Okay?
I'll take one more question if there is one, otherwise Martin will be in the panel after. Yeah. Go on.
Hi, love the presentation. Is this related in any way? Sorry, my name is Hassan. I'm CIO at Health IQ. Is this related in any way to the digital health accelerator or the digital catapult or anything that we've seen is going on in London specifically around digital and NHS?
It's separate but alongside. So I think there are a lot of initiatives going on in multiple areas, and this is where you often get this sort of silo effect of NHS England, certain parts of NHS England offering cash incentives for X or Y, and then you've got Department of Health doing stuff, and then you've got Public Health England doing other bits and pieces. But this is sort of the main route for this, and then the others will hopefully feed into that.
Okay, great, Martin. Many thanks. Okay. Thanks very much.
Thanks.